Welcome to the EAU podcasts. In this episode, UROONCO Bladder Cancer Chief Editor Dr. Pradere interviews Professor Kitamura on the JCOG1019 study, a Phase 3 study comparing the effectiveness of watchful waiting and intravesical BCG in patients with high-grade PT1 bladder cancer, with PT0 on the second transurethral resection specimen.
Dear colleagues, it's a pleasure for me today to have a new guest for the EAU UROONCO platform podcast. Today we are at ESMO 2024 in Barcelona, and I am with the head of the Department of Urology in Toyama, Japan, Professor Kimura, who presented today his study, a randomized clinical trial in the setting of non-muscle invasive bladder cancer. Professor, thank you very much for your time. Please, can you tell us a bit about the rationale behind your study and why did you get with this idea to perform such a randomized trial?
Thank you, Benjamin. It's my great pleasure to introduce the result of our clinical trial. The rationale is high-grade T1 bladder cancer has a malignant potential to it may progress to muscle invasive or metastatic disease. But high-grade T1 bladder cancer is heterogeneous. We focused on the high-grade T1 bladder cancer, whose second-tier specimen showed no residual tumor. So, as you know, the standard treatment for high-grade T1 bladder cancer is TURBT, second TUR, followed by intravesical BCG.
Yes.
However, intravesical BCG is toxic, and there's a problem of BCG shortage, especially in the United States. We wanted to know whether patient with high-grade T1 bladder cancer without residual tumor on the TUR specimen, second TUR specimen, are required intravesical BCG after second TUR.
Okay, so basically you propose watchful waiting and surveillance after the second TURBT. So it's a randomized clinical trial, multicentric in different centers in Japan?
Exactly. This is a Phase 3 multi-center open label randomized controlled trial.
And so what were the patients that you included in this trial?
Sorry?
Only T1, but you excluded CIS and TA high grade.
Exactly. Only high-grade T1. So we basically excluded CIS, and we checked our urinary cytology, 2 consecutive urinary cytology, and the patient had no positive urinary cytology were registered.
And what was, for this RCT, what was the primary endpoints that you assessed?
Yes, the primary endpoint was relapse-free survival, excluding TIS or TA, intravesical recurrence. In other words, relapse-free survival, including T1 or deeper intravesical recurrence or extravesical recurrence.
Okay. And so you were also excluding TA high grade. You didn't consider TA high grade as a recurrence?
No.
Okay. So you have presented the data today. What are the results that you presented?
Yes. Finally, the watchful waiting demonstrates statistically significant non-inferiority to intravesical BCG in terms of relapse-free survival.
Okay. Did you have any data regarding overall survival as well?
Yes. Overall survival, no difference between the arms, and relatively better in watchful waiting rather than intravesical BCG.
In your data, as far as I remember, you have a quite long follow-up for this patient that were either in watchful waiting or in BCG. What was the average mean follow-up time?
Yes, the median follow-up period was 7 years.
7 years?
Yes.
Wow. Okay. And so some patients were on surveillance for 7 years without any progression or recurrence for T1 or more, or T2, right?
Yes, yes.
And so according to these results, where you say that potentially for patients who are T0 at the second RTORBT, we can propose surveillance in this patient and avoid BCG. How do you see these results implemented in clinical activity? Because we don't want neither to have more recurrences for the patient. So how do you see it?
Yes, it's a great point because in terms of intravesical relapse-free survival, including TIS and TA intravesical recurrence, the patients in the intravesical BCG arm are relatively better than watchful waiting group. So basically, we recommend watchful waiting for patients with high-grade tumor bladder cancer and no residual tumor on the second tier specimen. From the point of view of survival benefit or avoiding radical cystectomy, but in all intravesical recurrence, the BCG was proved to have a prophylactic effect. So we have to say the survival benefit watchful waiting is recommended, but the intravesical BCG is still option after second tier in such patients.
Okay. Yeah, I think it's a great point that we can propose surveillance in very selected patients. Still, we didn't look at all recurrence-free survival, only T1 recurrences or more, or T2, so progression. I think the concept that you bring here comes in a more global way that we are trying to do de-escalation in non-muscle invasive bladder cancer. We do more fulguration, more active surveillance, and more chemoablation, and everything that can avoid more TURBT and more complex treatment for our patients. So definitely these first randomized clinical trials will open the door for new concept in the use of surveillance for patients with T1 and T0 on the second RTORBT. Do you have any other comments that you want the audience to get from your personal experience with watchful waiting?
Yes. Actually, in Japan, the PDD TURBT has become widespread. And so in some institute, they skip second TUR after PDD TURBT. But actually, we have no answers to questions whether the patients who underwent PDD TURBT are required intravesical BCG. So we need further clinical trials.
Yeah, there are actually some clinical trials that are investigating the best patients where we can omit a RTORBT after first TURB. Yes. So probably there will also be more things to do and more things to investigate with avoiding the RTORBT and propose sometimes some watchful waiting as well. But still, it remains for very selected patients. But I was very impressed by these 7 years of follow-up in your data, and I think it's a great trial that you build up. And thank you very much.
Thank you very much.
Thank you.
Thank you for listening to this episode of EAU Podcasts. To keep up to date with bladder cancer developments, visit our educational platform UROONCO Bladder Cancer. For more EAU podcasts, please go to your podcast app and subscribe to our EAU podcast channel for regular updates.